cervical screening, HPV, and cancer. I cannot tell you how many times I have been asked to go into detail about these topics, so I am incredibly excited to share today's episode with you and for you to just indulge in all of Dr. Sesay's knowledge bombs because they are powerful. I can assure you that. So, as I've said, today we are going to be talking to Dr. Aziza Sesay. She is a NHS GP with a passion for health education, awareness, advocacy, and empowerment. She channels all of this through her platform at Talks with Dr. Sesay, and that is no spaces, and Sesay is spelled Sesay, where she shares short information videos, infographics, live discussions, and tips on a variety of topics, including women's health, cancer awareness, mental health, and health inequity. Enjoy all of this powerful information coming your way from Dr. Aziza. Welcome to today's episode of the Nurture Pod, where we will delve into curious questions in pelvic health. I am Candice Langford, a pelvic health physiotherapist, eager to explore the minds, skills, and expertise of pelvic health professionals, and of course, share those conversations and learnings with you. But first, let's talk about bladder leaks. Are you using the correct pads or panty liners? Because periods are not the same as pee. I'm excited to share that Lilette's have a new range of dry lock pads and panty liners specifically designed for incontinence with 3 times more absorption. Pads and panty liners are not a band aid solution to leaks. As a pelvic health physio, I believe that the correct products play an important role in giving you the control and the confidence to move through your day whilst working with professionals to improve your symptoms. All right, so Dr. Sesay, it's nice to meet you. It feels like I know you already, and if any of you are on social media, you'll see that Dr. Sesay and I have done a little reel with the Spice Girls, which was quite a little throwback. But today, we're not talking about the Spice Girls nor throwbacks. We are here to talk about 3 important topics which overlap and topics that we all definitely need to know more about. So they all kind of deserve it of their own podcast, but we really do need to kind of cover the foundation. So we're going to do that today. So my girl, if you can help us, Dr. Sesay is going to tell us about cervical screening, HPV, and cancer. Give us the lowdown, help us understand what does it mean if we're going for an appointment for a screening, and if we do get a diagnosis, where to from there. Help us to just understand what's going on with these 3 terms.
Of course. Thank you so much for having me, first of all, Candice, and on such an important topic as well. We cannot talk about this enough. I'm really passionate about it, and I hope that anyone who's listening in learns from this and goes on to share the knowledge gained with your family and friends. So, just like Candice said, we are talking about cervical cancer, cervical screening, and HPV, which stands for human papilloma virus. So, I always like to start this off by emphasizing the importance or the fact that cervical cancer is one of the most preventable cancers. It is literally said to be 99.8% preventable, which
Oh,
is really crazy when you think about it, because it means that it's a cancer that affects, I think they say about, in the UK, you get 3,500 people with a cervix diagnosed with cervical cancer every single year. And sadly, you get about 2 people dying of the cancer per day, and it's
per
preventable.
day.
Hmm.
Wow. I thought you were going to say like per month, per
No,
term,
per
per
day.
day.
Per
That's
day.
too high.
It is, it is. But this is why I want to raise awareness about the fact that it's preventable and that what we can do to try and prevent it. So, when we talk about the human papilloma virus, this is a very commonly occurring virus that they say 80% of us will have experienced or been exposed to um, within our lifetime. But what's amazing about our body is that it's really resilient and we're able to fight it off. And we often, they say 90% of us will have fought it off within 2 years. Okay. So it's something that our body can fight off, but there are hundreds of different types of HPV, and 13 of them are considered high risk. And they're considered high risk because they're linked with cancer. Now,
Okay.
HPV is linked with cervical cancer. Obviously, that's what we're talking about. It is 99.8% linked with cervical cancer, but it's also linked with anal, head and neck, vulval, and vaginal cancer. So when I'm talking about HPV, um, and it's linked with cervical cancer, what happens with HPV is it gets to our cervix through any form of sexual contact. So it spreads through skin to skin contact. And this could be obviously penetrative sexual contact, but it could also be as simple as oral sex, fingering, and sharing unwashed sex toys.
Yeah,
It's
yeah.
very, very easily transmissible.
So
And it gets,
that's
go on.
sorry, Dr. Ziza, Sisay, that's really, yeah, that's really interesting because I have heard that it's incredibly, um, so I have heard that it's really easily transmissible, right? And now you are saying how just exactly how easily transmissible it is. And what I would like to just kind of just pause on here is wondering how outside of intimate or sexual contact, are there statistics on how many individuals are contracting HPV outside of intimacy, outside of partnered intimacy? So, for example, oh, I don't know, like you say, using or sharing toys, but
Mhm.
outside of that, there may be the likelihood of touching things or things touching the vulva, or
Mhm.
are there any statistics on that? Or, do we need to be cautious on that front?
To be completely honest, I don't know what the specific statistics on that is. What I do know is that they say 80% of us will pick it up in our lifetime. But for it to get to the cervix, it
Aha.
is through sexual contact. But
Okay,
a
so
lot of
really
people,
great distinction there.
mhm,
Because like you said, we're really good at fighting this thing off. So
yes,
people don't have to be anxious about everything they come near because
yes,
it's easily transmissible. It's more being cautious of intimate encounters where it would then be transferred to the cervix. And
yes.
I'm assuming we are just as good at fighting it off, or is this something that you are going to get to a little bit later? Are we just as good at fighting it off when it gets to the cervix?
Yes. So it all depends on what our immunity is like. Okay. So certain things can affect our immunity. And if anything affects our immunity, it affects our ability to fight off HPV. So things like smoking, we know that smoking affects our immunity. And so it reduces our ability to fight off the HPV, which then increases the chances for the cells of the cervix to change. And it's because the cells of the cervix change, eventually they become abnormal, which then forms cancer.
Okay.
So if we do things to try and preserve our immunity, so eating healthily, exercising, and also, and I'll talk about this at length at some point, getting the HPV vaccine, which increases our immunity against certain types of HPV. Again, that improves our chances of fighting it off. Other things that can affect our immunity would be certain types of drugs. So, for instance, people who are on steroids or um, there's specific immunocompromising drugs. So, patients, for instance, who may have had transplants, they will be on drugs like that. So, that can increase the chances. Also, if you have the virus HIV, which essentially is all about immunodeficiency, that again increases your chances of your immune system being affected, which then reduces the ability to fight off the HPV. So all of these things have the potential of affecting our body,
Yeah, of
reducing our
course.
chances, and increasing our risk of of getting cervical cancer.
Okay. So you, like you said in the beginning of that, our general lifestyle is incredibly important, and we
Absolutely.
see this as a thread kind of coming through most topics about health. It's about sleep quality, stress management,
Yes.
healthy eating, drinking well. All of those things, exercising, all play such an important role in our general health. And here it is once again impacting our ability to fight off something so common such as
Yes.
HPV.
Absolutely. And the reality is, if we talk about statistics, they say that about 30 to 40% of cancer in general can be prevented by us altering our lifestyle. So, not smoking, making sure that we're a healthy weight, we're exercising and not remaining sedentary, we're not drinking too much alcohol, we're eating more fruits and vegetables. All of these things impact our chances of developing cervical cancers or cancer in general. So, it's really important to remember that fact.
Incredible. I've definitely come across, on other podcasts and in research and just things that I've read where our lifestyle factors are playing such an important role in like you say, in cancers as well. So yeah, that thread continues, and it's definitely here in this topic of HPV and cancer once again. Okay. I took you on a bit of a tangent there, Aziza.
It's
I do
okay. There's
apologize.
so much to talk about.
Yeah, perfect. I absolutely agree. Such a juicy topic, or juicy topics in general.
Yeah, no, definitely. Okay, so we've spoken about HPV, we've spoken about its link with cervical cancer. I wanted to talk about other things as well that increases our chances of getting cervical cancer, or something that helps to prevent cervical cancer, which is cervical screening. It's really, really important. It's said to reduce it's said to prevent cancer by such a significant amount. And what happens with cervical screening? So the newer version is what's called HPV primary screening. So it's a test to check the health of the cervix. It's not a test to check for cancer. And how what it does is it helps to prevent cancer from occurring. So what they do is they take samples of the cervix using a brush, um, and then put it onto this preservative liquid, and they look at it under the microscope. What they're looking for is for high risk HPV. And if the person has high risk HPV, they then check to see if there are any cell changes or any abnormal cells. And then, depending on the severity, they may do certain treatment. But often, if you have abnormal cells, you then get called for what's called colposcopy, which is where they look at the cervix under a microscope. They may also put a dye so that they can expose the cells. They can have a look at the cervix even clearly and expose any potential abnormality. And then, depending on what they find, they may take biopsies, or they may do a procedure called LETS. So that's loop laser loop excision of the transformation zone. So I'm going to talk about the transformation zone. I hope you don't mind,
No,
but I
please
want people
do.
to understand why they take it from there.
Yeah.
So our cervix is made up of two different types of cells. The inner canal of the cervix is made up of, I'm just going to say glandular cells. So there's specific types of cells. And then the outer one is more sort of a roughened type called squamous cell, sorry. And where they meet in between is called the transformation zone. And unfortunately, within that area, because the cells are changing from one to the other, that's what increases the chances of cervical cancer developing. And that's where cervical cancer will develop. And that's why when they do the LETs, they remove the cells from that area in the hope that they completely get rid of potentially the cancer from developing at all. But then they have a look and they can confirm all of that once they look at the biopsy results.
Okay, sure. All right. So the first thing I want to say, want to ask you here is this different from going for your typical pap smear? And I will just be kind of transparent here and say I went I went for a pap smear, and the doctor said to me, "Have you been screened for HPV?" And I honestly said, "I have no idea." I've been for
Yeah,
pap smears before, but I have no idea.
yeah,
No one's actually asked me.
yeah.
So I suppose this question might be twofold. Are they doing this at the same time if they're doing a specific screening? And then, yes, yeah, let's start there. Is it the same thing? Is it done at the same time? And must I specifically request, or are doctors standard doing it at your pap smear?
Okay. So in the UK, what used to happen before was that they would do what's called cervical cytology. That's where they would look at the cells. Okay. That was what they were doing specifically initially in the screening. They would look to see if there were any abnormal cells and then manage it depending on what they find. However, they've recently, and this is over the last sort of 2, 3 years, changed to what's called HPV primary screening, which is where they initially check for HPV, those high risk HPV that we spoke about. And if there is high risk HPV, then they check for the cell changes. And if there's cell changes, you go for colposcopy. So that's how it works in the UK. And I believe they use a similar method in Australia and a couple of other places. So you don't need to request specifically, oh, I want to get my HPV checked, or check my cell cytology. I don't know if it's different in the States, but what I do know is that over here in the UK, for sure, they check for HPV first. And the reason they do that is because of that close link. So the likelihood of you having or getting cervical cancer, or you even getting any cervical cell changes, is very, very, very minimal. And that's if you don't have HPV, and that's why they check for HPV first, because as I say, the link is 99.8%.
Yeah, yeah.
Yeah, I
Okay.
hope that makes
Okay.
sense.
Yeah, yeah, that makes sense. And are we supposed to be doing what would you recommend with regards to how frequently people should be having this screening?
Yeah.
So I
So
think
that's a
that's
really,
changed a bit as well.
yeah, that is a really, really good question. And I think it's also a bit controversial because so many people are a bit dubious about how things are currently. However, the reason that they've changed things is because there's been a lot of research and a lot of evidence in keeping with the new method. Okay. So, because of how sensitive HPV primary screening is, they've now opted for people to be screened every 5 years. So before, it used to be, at least in the United Kingdom, it used to be that people with a cervix, or women between the ages of 25 to 49 would be screened every 3 years. And the
Mm,
reason that it was that case was because people within that age group are at the highest risk of developing cervical cancer. Cervical cancer is actually more commonly occurring in younger women than older women. However, because of the new screening, and they've only recently again confirmed how sensitive and effective it is, because they're using the HPV primary screening, it doesn't need to be checked that frequently. Having said that, this is where women and people with cervix need to be very, very aware of what cervical cancer symptoms are. Okay,
mm,
yes, they're not going to be screening as frequently, but that doesn't mean that you should just, wait for whenever your screening is to get tested, because if you are having symptoms, just get it seen to, just in case. So the symptoms of cervical cancer include any abnormal bleeding or any unusual bleeding. So that's if you're bleeding in between periods, you're bleeding during or after intercourse, or if you've gone past the menopause, you start bleeding. So when I say menopause, I mean you haven't bled at all for 12 months, and then all of a sudden you've had a bleed. And then other symptoms include having any unusual or foul smelling discharge that you've not had before, any pain or aches and pains in the hip area, any pain
mm.
during intercourse when you've not had that before. Now, these symptoms can happen with a lot of other sort of benign conditions.
Yeah.
So I'm not saying that if you have these symptoms, it means you have cervical cancer. Not at all. However, if you do have these symptoms, they're not ones that you should sit on and say, oh, let me just see what happens. Please go and see your GP or your doctor. Tell them about it so they can do the relevant investigations to rule that out. And another thing to say is when we talk about screening, because quite a few people get confused about it, screening is a test for apparently healthy individuals. So these are people we are assuming have no disease. So that means they don't have any symptoms at all. So it's used to test people, to screen them to see if they have any cancer. Whereas when we're doing diagnostic tests, if you have symptoms, you don't go for screening. We want to make sure absolutely if you have cancer or not. So we would do diagnostic tests, specific tests. I just wanted to emphasize the difference between the two, just in case people again think, oh, I have my screening in 2 months' time, I have unusual bleeding. No, let me just wait for my screen. You don't need the screening because it might not pick it up. You actually need a diagnostic test like colposcopy or all these other things.
Okay, yes, that was going to be my next question. So what would that be? And it's what you explained prior, which would be the colposcopy. Okay.
Right.
I just want to make sure that one thing is clear. Pap smear versus primary HPV screening.
Yeah.
Is it the same thing?
I believe so. So pap smear is an older name,
Okay.
and it used to be called pap smear because of they used to use a spatula or some sort of, it was a different type of
Tool.
device, whereas now
Yeah.
they use a brush to collect. It literally used to be a smear of the cervix, whereas now they use this, the newer version is the brush, but people still use pap smear interchangeably. So I believe technically they are the same thing. Yes,
Okay.
and the newer version is that they're testing. They're still testing the cell samples, but they're specifically initially testing it for HPV.
Okay. All right. Yes, because there wouldn't be anything else that they would be specifically testing for when you were going for a in inverted commas pap smear, correct? They're
Not that I
specifically
know of.
looking at those cells,
Yes.
unless, of course, there are other things. I mean, everyone is so different. There are a multitude of reasons as to why you might go to a gynecologist, but in this specific topic, okay, perfect. Thanks for that clarification there. And and I'm glad that you've defined, at least in the UK, that it would be every 5 years.
Yes.
In the absence of symptoms, if you're symptomatic, you need to go to your doctor. But in the absence of symptoms, you'd go more or less every 5 years. Because when I was in South Africa, initially they were saying go for your pap smear every year. Um,
Mm-hmm.
and then by the time I left, which was the end of last year, end of 2021, it was more go every 2 years.
Mm-hmm.
And now I'm 32, so I'm definitely in that age bracket. So I should
Mm-hmm.
actually only be going, according to the newer guidelines, like you were saying, every 5 years in the absence of symptoms.
Yes, but I do want to stress here that the UK, there are four different countries, and it's at the moment, it's Scotland and Wales that are doing it every 5 years for that age group between the ages of 25. Well, actually, for all of them, 25 to 64. But in England, and this is something that will literally be changing very, 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 very soon, to 5 years. But in England at the moment, it's still at 3 years for the age groups between 25 to 49. However, things will change. And then in Northern Ireland, they still are using the older technique, which is where they test for the cells first. So just in case anyone from the UK is listening and they're in either of those places and they think, what? That's not what I'm having.
Okay.
Just to
Okay.
clarify, yeah.
Yeah, absolutely. And things change so much, so we really need to communicate with our healthcare provider,
Absolutely.
because, as with every episode, this is not personalized healthcare. This is just information sharing. So if you're
Yes.
uncertain, chat with your healthcare provider in your region, because that is going to be first and foremost the most valuable thing that you can do, because we all deserve a personalized and bespoke approach to our healthcare. All right,
Agreed.
so I just want to stop there before we go maybe further into maybe like the sin, and maybe going into a little bit more about cancer, about the vaccine, the HPV vaccine. So when I when I was younger, what I recall, it was, if you haven't had sex, you must have the vaccine.
Hmm.
And then there was all this confusion about, what if you have?
Hmm.
And who's it for? Is it too late for those that have engaged in penetrative intercourse in
Hmm.
particular? Because sex can be defined as many different
Yes.
things.
Yes.
Is it too late? Are we still doing it? At what age? What are the rules around that?
Okay. So how it works with any sort of these type of injections, injections or immunizations, what they're trying to do is get your body to build up immunity, okay, against the organism. All right. And if we haven't been exposed to it, that then improves our chances of building that immunity. You understand? So if we've never been exposed to it at all and we get it from the injections, then we build up the immunity against any of the forms that are within the types of vaccines that we're having. So there are at the moment, three different HPV vaccines. There's the first, second, and third generation. The first generation only had two of the high risk HPV, which included 16 and 18. Those are the ones that 70% of cervical cancers are linked to. And then the second generation had included two more, which was to do with warts. And the newer generation has 9 different high risk HPV. So it's quite good in that hopefully it builds up your immunity against those. Now, that's why the age groups that are targeted initially are between the ages of 11 and 13, because the hope is they're not sexually active at that stage. So they get invited, they get the injection. If you have it between those age groups, you usually only need 2 doses, and you have it 6 months apart. If you are over that age, if you're over 15, then the recommendation is that you have 3 doses, and you should have those 3 doses all within a 6 month period. And the reason you have an extra dose is because there's a potential likelihood that you may have already started sexual activity. So they're giving you that booster dose just in case. Okay. And now it is licensed up until the age of 45. And the fact of the matter is, they don't know the effectiveness after that age. And also, between the ages of 15 and 45, if you have it, it may not be as effective as it probably would have been um, at the earlier age. And again, if you weren't sexually active at all, and as I said, with HPV getting to the cervix, it's any sort of sexual activity. So if you've had oral sex or penetrative intercourse, fingering, sharing toys, all of that, that you've exposed yourself to HPV. So it's most effective if you've not been exposed to HPV at all. So yeah, then that's basically how it works at present. You can have it up to the age of 45. It is licensed, but the jury is out about whether or not it's that effective after that point.
Okay, okay. All right. And then one thing on that, would one have to go to their gynecologist, or would they be able to go to their GP in order to receive the vaccine? I'm thinking about moms of young teens, and I'm also thinking about potentially young teens who maybe don't want to speak to their mum about this because they're scared of the correlation of their mum thinking, oh, well, that means you want to now engage in penetrative intercourse. And we know and we acknowledge that there's a lot of taboo around that. So just kind of putting that out there for both mums and teens that are potentially
Of,
wanting to seek advice.
of course. Now, that correlation has been so misleading, and that's why there were so many kids that missed out on the HPV vaccine. So it doesn't mean that because you've had the HPV vaccine that you now have free reign to, go for sexual activity and not engage in sexual activity. That doesn't mean that that's not the case, essentially.
Yeah.
The point of the matter is we want to give it to the young girls and boys. It's not just girls, it's also boys, because boys can also pass HPV, to the girls at the end of the day. So you can't just protect one end. And also, boys can pass it on to boys, if they are homosexual and so on. So it's important that both girls and boys are given the vaccine. And the point is to prevent cancer. It's not to allow them to engage in sexual activity. That's what's really important. So if there are any moms who are listening to this, please, 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 this is if we can get enough of our youngsters vaccinated against HPV, which genuinely has been proven to be effective. There was a study that was released just towards the end of last year that said that it reduces the occurrence of cervical cell changes and also reduces the chances of cervical cancer occurring by 90%. That is how effective this vaccine is. Cervical cancer is preventable. There is a potential for it to be completely eradicated, and we can only do this if we engage in these sort of programs. So in the UK, how it works. And I keep saying the UK. So if anyone's listening, if you haven't guessed it, I am a GP practicing in the UK. So I'm giving majority of the facts based on the UK's. But just like Candice very kindly and eloquently put, if you're unsure, please do speak to your care provider. But in the UK, girls and boys between the ages of 11 and 13 are invited by their school to have the HPV vaccine for free. Okay. If you miss the invitation, some schools may allow you to have it the following year. However, if you can't get it from your school, you can go to your GP as long as you're under the age of 25 and you will get it for free. Okay, up until the age of 25, depending on whether you were if you were around the batch when it first started, which was 2008, when that's where girls were first initially invited. And interestingly, girls were the ones initially invited from 2008. And then eventually they thought, wait, no, actually, we need to vaccinate boys as well. And I think it was only until it must have been 2018 that they started to vaccinate boys. It took like almost 10 years for them to do the maths. But yeah, at least it happened. And then after the age of 25, again in the UK, you can get it, but you have to pay for it privately. However, there are certain groups who can get it for free over the age of 25, and that include up to the age of 45, and that includes men who have intercourse with men, people who suffer with HIV, and there's like a long list of
Okay.
women and men who have HIV, sex workers, and transgender people.
Okay, okay. That's really, really valuable. You've covered so many important points there, especially about the one that I want to just highlight and bring again is that parents mustn't avoid encouraging their children to go for this vaccine. It's not a ticket to engage in intimacy. It's a prevention for cancer.
Yeah.
Like it's bigger than that. And
Mhm.
if there are concerns about that, then potentially you can chat to someone to help with that knowledge translation between you and your child. And another really important point is that this is for girls and boys. And I do recall it wasn't so long ago. It
Yeah.
was 2018 that they all of a sudden thought, oh, okay, well, maybe we should be preventing this in other ways too. And such is the way with sex differences in healthcare. We are
Unfortunately.
continuously trying to play catch up for our old mistakes. But we are most certainly making all the good changes. Okay, amazing. So you have really enlightened us so much around screening, about HPV, about cancer itself. Is there anything else you want to touch on? I know that we have gone on a tangent or two, but it has been really, really juicy so far.
Oh, thank you so much. Again, thank you so much for this opportunity. I really, really hope that this helps potentially save lives and just enlighten people. One thing that I always stress about is for people to be familiar with what their normal is, okay? And the reason I'm emphasizing it again here is because, say, for instance, your periods, know what your normal is with regards to your periods. Know that, okay, my periods, my menstrual cycle is, say, for instance, everyone says 28 days. Let's say 28 days. That's my menstrual cycle. When I bleed, I usually bleed for about 3 days. It might be heavy for the first couple of days, and then it's light. So that's normal for you. If you
Mm,
start to notice changes in your cycle, so maybe your cycle seems to be shorter, or you are noticing that your periods have become extremely heavy when they weren't before, they've become really, really painful, or again, maybe you know what your discharge is like, because it's normal to have vaginal discharge.
mm,
Know what it's
mm,
like for you. If you start to notice that it's starting to look like more brown or black, or there's a really strong smell when you didn't have that before, those are all things that you should see your doctor about, just in case, because again, it can be linked with different conditions, but what we worry about obviously is cancer. So I always stress about knowing your normal, because you are basically the CEO of your body and you know your body best, right? So if you pick up something that's even the least bit different, trust your gut, get it checked. worst case scenario, best case scenario, it's nothing at all. Worst case scenario, it might be something, but hopefully you've picked it up so early that it can be treated. You know what I mean?
Yeah.
Yeah, and the
I love
prognosis is
that.
better.
I love that. We are the CEOs of our own bodies. And if something changes, we should have that body literacy to know this is different, but not
Absolutely.
panic. Take that to the relative healthcare provider and discuss it, and not feel that sense of shame and taboo around discussing things associated with, for example, your vulva, but rather bring it to their attention just like you would say, my throat is sore, and open up your mouth wide and kind of say, look inside here, look, it's sore. We need to have that same level of confidence and comfort in speaking about all of our body parts, because they all contribute to our holistic health and well-being. And I think that you have really, I do believe that this is an incredibly powerful 30 minutes of information. So I'm so grateful. You are doing an amazing job on social media about, just lightheartedly yet powerfully bringing information to the forefront of people's social media feeds um, to change lives. So I'm so grateful for what you've shared here, and I'm so grateful for all that you're doing on social media. It's a controversial platform, but can absolutely, just change the way people experience their day to day. So you are doing all the right things on that social media platform of yours. So thank you so much.
Thank
Um,
you. You
uh,
too. You're doing amazingly. I really love whenever you say that, the throat and the vulva, vagina, and all of these things. Like, it is just part of our body, and it's not a dirty word. There's nothing wrong with it. We need to be just as comfortable and confident speaking up about these parts of our body, and not, suffer in silence. I love what you do, honestly. It's brilliant.
and I love what you do. So thank you. Maybe we'll do another little Spice Girls throwback one day down the line. Um, Thanks, Michael. I really do appreciate that. And I can echo exactly what you said, because you're doing an incredible job. So, there, like I said in the beginning, each of these topics, HPV, cervical screening, cancer, they all deserve their own episode, because they are big topics, and we have really gotten a big chunk of information from today. But I can assure you that everyone listening is going to want to know more, and want to know more from you, because you are just giving us pearls of wisdom here. You're just dropping all the information that we need. So if you can just share with us how exactly everyone can hear more about you, learn from you, and yeah, tell us exactly where you're at.
Okay, so thank you so much. So I am at basically most of the socials: Facebook, Instagram, and TikTok. I'm at Talks with Dr. Sesay. And I'm also available on my website, talkswithdrsesay.com. And also, if you want to drop me an email, I'm at drsesay101@gmail.com.
Amazing. And everything will be linked in the show notes. So, and otherwise, you can always see links to Dr. Sise on my social media if you are confused about spelling or anything like that. But absolutely all in the show notes. And yeah, you'll see here all of my stories, because I'll be sharing her good stuff. Okay, thank you so much, my girl. I am so grateful for your time. You are a treasure, and I am so grateful to have met you.
Thank you.
Well, NurturePod listeners, until next time, please review and subscribe, and as always, stay curious. As a special treat for listening to today's episode, you can head over to the nurturepelvichealth.com website and use the code NurturePod for a 20% discount on all pelvic and sexual health courses. This episode is brought to you by the Lilette's Dry Lock Incontinence range of pads and panty liners specifically designed for bladder leaks. Because you deserve to maintain a healthy, happy, active lifestyle in the presence of leaks. This is why when working with patients with incontinence, I encourage them to use the correct type of pads as they work towards their treatment goals.